Hello everyone, this is Dr. Cui. So from this video, I will introduce some basic knowledges, uh, some basic clinical knowledges for the medical student or the uh, first year resident who are going to doing clinical rotation. And based on my own experience, this knowledge is very useful, and if you can master it, it will give you an easy life during the rotation. So now I'm going to talk about the EKG first. So in this video, I would let you know how to quickly interpret the EKG. And I know some people, some students can read the EKG, but still, actually, most of them cannot read it organized. I would say that they don't know how to read it following a rule or just or just a rough or just roughly have a look at EKG and uh, and cannot give us can and sometimes they will miss some important information and by just roughly look at the EKG. So in this video, I would like to teach you how to read it step by step, and uh, and you won't miss any details in the EKG. So let's get started. So first thing first, we definitely need to know some basic knowledge of the EKG. So for the standard EKG recording, the paper speed is about 25 millimeter per second. The voltage is about 10 millimeter per millivolt. And in the standard EKG paper, we can see that there are 5 times 5 small squares in the big square, and the x-axis stands for the time, and the y-axis stands for the voltage. So you can see that the horizontal line in the small square is about 0.04 second, while in the vertical line is stand for the 0.1 millivolt. And so in the big square, the horizontal line is 0.04 times 5, which equals to the 0.2 second, and the vertical lines is about 0.1 millivolt times 5 is 0.5 millivolt per big square. So here's a standard EKG graph. You can see that the P waves stand for there are 4 waves here, and the P wave stand for the atrial depolarization, QRS is a ventricular depolarization, the T wave stand for the ventricular repolarization, and here we missed the atrial repolarization, which hiding in the QRS complex, so we cannot see the atrial repolarization here in the EKG. So, and also we have a UV, which means the stands for the recovery of working ear conduction fibers, and it may not be observable in the normal conditions. So after knowing this, we can so the next very important thing in this topic is how to interpret the EKG step by step. As I mentioned, here I give you like 11 steps. So include the first step is to know the rhythm of the EKG and following the heart rate, electric heart axis, P wave, PR interval, QS complex, T wave, QT interval, SD segment, an overall review of the EKG, and the last, and but not least, the clinical evaluation. So even the EKG is, you can see that some significance of the EKG, probably there's no clinical significance, or even the EKG is negative. You cannot see any significant EKG, but sometimes there are some clinical significance there. So after interpreting the EKG, you have to relate it to the clinic, to the real to the real conditions of the patient, to see that if can correlate to each other. So that's the last step, which is very important. You need to keep in mind. Okay, so first the rhythm. So in order to know EKG rhythm. So normally we use the RR interval or PP interval to decide to know if it's regular or irregular. So you can see that in the first EKG graph, the RR interval is both RR interval and the PP interval same, which means it's a regular rhythm. And in the graph below, you can see that there's no P wave here actually, and the RR interval is irregular, which means the rhythm is irregular. And here actually this is the EKG for the atrial fibrillation patient, the patient with atrial fibrillation. So the second one, we want to know how to calculate the heart rate based on the EKG. So the easiest way for doing it is by using the 6-second R waves times 10 method. Actually, so basically you can see the EKG, we just count the R wave within 6 seconds, and then use the number of R waves to times 10 to get the R rate. So in this one, we see that there are 7 R waves. So we times 10, which equals to the 70. So the heart rate is 70 per minute. So by using this method, it's good for both regular and irregular rhythm of the patient. Well, so we also have the second method to also have other method to calculate the heart rate. And for example, we can use the number of small boxes for a typical R interval and divide this number into 1500 to determine the heart rate. But this method can only be used for the regular rhythm, because you cannot use it for the patient with the irregular rhythm. So that's why I strongly recommend you to use the first method to calculate the heart rate. Okay, so the third step, we want to know how to determine the heart axis. So actually, here I give you, there are a lot of ways to do it, but here I give you the fastest way, the quick method to read it, which is also my favorite one. So I just use two leads to determine the lead one, the AVF. And so now here we also need to use R to S ratio for this method. So if, for example, if in the QRS complex, if R is bigger than the S, so R to S ratio is bigger than, which means R to S ratio is bigger than 1. So we think it's a positive. And if the R to S ratio is lower than 1, we think we treat it as a negative. And if it's equal to 1, it's ISO. So we can see that in the lead one, in this example, the lead one R is definitely bigger than the S, and also we know that the lead one is the lame lead from the right to left. So it's a right to left. So we think the vector of the lead one is a point from right to left as a negative. And in the AVF, we can see the R is of course, R is also bigger than the S, so R to S ratio is bigger than 1, it's also positive. So in the vector AVF, it's from up to down. From the up to down, it's a positive. So we combine these two vectors together, so we can see that the QRS complex in this EKG is about 45 degrees, which is located in the normal axis. Is a normal axis range. So here I give you the whole picture of the EKG vector. We can see that in the normal QRS axis, it's located from the -30 to 90 degree. In the left axis deviation is from -30 to -30 to -15, -30 to -90, and the right division is from the positive 90 to 100. 80, and the extreme axis is from -90 to 180. So you can after knowing this, we can use this table to determine the axis quickly and effectively. So you can see that, as I mentioned, if the lead one is positive, AVF positive, so which means the axis is normal from, and if the lead one is positive, AVF is negative, so it's a left division, and if lead one is negative, AVF is positive, it's a right division. And if both lead one AVF negative, so it's in the extreme axis. So we can actually in this graph, they just treat the normal axis from 0 to 90. Actually, sometimes if you want to do it more accurately, actually it's the normal axis ranges from -30 to 90, but still the 0 to 90 is in the normal range for sure. Okay, so now I'm going to give you an example how to determine the axis in the real EKG. You can see that in the upper panel of the EKG, the lead one is a positive, and the AVF we can see that the R to S is negative, right? Because the S wave is bigger than the R. So lead one is positive and the AVF is negative, which means the deviation is left. And we can see in the lower panel, we can see that the R in the lead one, the R to S ratio is lower than 1. So lead one is negative, and the AVF for the AVF, the R to S ratio is bigger than 1. AVF is positive, so which means it's in the right division. So it's pretty easy. Okay, so this is for the first part of the EKG interpretation. So I will talk about the rest of steps in the next video.